So the motivation behind producing the nurse job guidance in the first place is that there was a gap following our work that we did with the RCN Rheumatology Competency Framework. And certainly there was lots of nurses asking the question about how to put together their job plans, and also looking at what people were doing within their roles. How many clinics should we do in a week when we're working full time? How much time should we be spending with each particular patient? So the role of the specialist nurses in rheumatology has certainly evolved over time, and this has reflected the change that we've seen in the treatments that we give people with inflammatory diseases and the understanding that we now have in the inflammatory process. Our role has evolved to reflect that and to make sure that we meet the clinical need of the patients. One of the surprises of the survey was the answer we got back from the nurses about how much time they have to do their education, etc. And the fact that 75% of those who responded do not have timetabled activity for education, audit, and that's very much due to the demands of their clinical workload.
Part of me wanting to look at the job planning, as Trish has mentioned, is that when I was doing part of my chair role, a lot of the nurses would come back, they hadn't got job plans, and professionally that worried me. Personally, I was in the process of doing upbanding for part of my team, and I was looking at RCN credentialing, so that really focused where I was at with job planning and where is that hidden work that we still are not acknowledging and that our consultants don't know what we do. So I wanted to put the nurses on the map. We have new pharmacists working with us and sitting in clinics that we supervise that is not on our job plan. And for me personally, looking at this, it's made me look at taking it to my PDP, my appraisal, but also helped me to look at credential and use it as part of my competence to show what level I'm at. You have a look what you're doing and don't just say, I'm in clinic. It's what do you do in that clinic? And it's using that language, like you said, our medical colleagues understand.